A bold leap towards healthcare equality. In his recent State of the Nation address, President Ferdinand R. Marcos Jr. made a powerful declaration, prioritizing healthcare reforms to tackle the nation's pressing need for accessible, affordable, and high-quality medical care. His speech was a beacon of hope, demonstrating the administration's readiness to allocate significant resources and political will towards revitalizing a sector that has been crying out for attention. A promising alliance. The Pharmaceutical and Healthcare Association of the Philippines, PHAP, representing the biopharmaceutical industry, applauds these moves. The president's emphasis on healthcare reform is both timely and essential. While the direction is promising, the journey ahead demands meticulous planning, collaborative efforts, and steadfast dedication to long-lasting reforms. Transformative measures. One of the headline initiatives is the provision of continuous free dialysis for individuals battling kidney disease. The government has also raised the coverage limit for transplant patients to 2.1 million pesos. A significant leap from the previous 600,000. This includes post-operative services and essential medicines, commencing this year. PhilHealth, the National Health Insurance Program, has expanded its benefits, enhancing financial support for critical procedures like open-heart surgeries, heart valve interventions, and intensive care for severe dengue cases. Additionally, the coverage for cataract surgery has been bumped up to 187,000, and access to the HPV vaccine will broaden. Cancer Care Revolution. An allocation of 1.7 billion pesos for cancer medications not previously covered by PhilHealth marks a pivotal advancement. The president also mentioned alternative funding avenues such as the Cancer Assistance Fund, CAF, medical assistance for indigent and financially incapacitated patients, MAIFIP, the Philippine Charity Sweepstakes Office, PCSO, and the Philippine Amusement and Gaming Corp, PAGCOR. These measures indicate that the government is actively responding to the healthcare community's concerns and, crucially, to the plight of families burdened by exorbitant out-of-pocket medical expenses. Bridging the gap. The proposal to create 53 Bagong Urgent Care and Ambulatory Service (BUCAS) centers in 32 provinces further amplifies the momentum. These facilities, providing complimentary consultations, X-rays, and lab tests, promise to deliver prompt care to underserved populations, assuming they are properly staffed and equipped. The PhilHealth Yaman ng Kausugan program complements this initiative by reinforcing primary care services at the grassroots level. A comprehensive approach to health. These initiatives collectively embody a comprehensive perspective on health, encompassing prevention, early diagnosis, treatment, and rehabilitation. However, the true measure of success will be in the implementation, sustainability, and public-private synergy. Maintaining these reforms over time is a critical challenge. Herein lies the importance of robust public-private partnerships. PHAP has pledged its support in executing and fortifying these changes. The biopharmaceutical sector is pivotal in securing access to life-saving drugs and health innovations. Yet, achieving this necessitates regulatory flexibility, specifically in enhancing the Health Technology Assessment, HTA process. Delays in HTA approval can obstruct swift access to cutting-edge therapies, particularly in an era of rapid scientific advancements. Balancing speed and rigor. Optimizing the HTA process doesn't entail sacrificing scientific integrity. Rather, it ensures timely, transparent, and patient-centered evaluations. Achieving this equilibrium is crucial for a healthcare system that remains adaptable and pertinent. Focusing on equity. Equity remains a cornerstone of these reforms. Although the measures address major health threats like cancer, cardiovascular diseases, and kidney failure, concerted efforts must ensure that the benefits trickle down to the most vulnerable. A new era of healthcare reform. A president's declarations are a welcome stride forward. However, healthcare systems are intricate ecosystems that flourish through unified action. What truly counts is whether these reforms lead to tangible, quantifiable improvements in the lives of everyday Filipinos, alleviating financial strain and enhancing health outcomes. Embarking on this new phase of healthcare reform, it becomes evident that no single entity can shoulder the burden alone. Genuine progress hinges on the concerted efforts of the government, industry, healthcare providers, and patients, all united by a common vision of a future where each Filipino, irrespective of wealth or location, enjoys access to quality, affordable healthcare. PHAP and the biopharmaceutical industry are steadfast in their commitment to this collective endeavor. Be it by expediting access to novel treatments, supporting regulatory reforms, or fortifying health infrastructure, the private sector is poised to significantly contribute to the health and welfare of every Filipino. Teodoro B. Padilla, Executive Director of the Pharmaceutical and Healthcare Association of the Philippines, champions the biopharmaceutical medicines and vaccines industry. Its members are at the forefront of research and development for COVID-19 and other diseases affecting Filipinos.